Hello and welcome to all our Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And with me, I have a special guest. It's Sarah Hornsby. Welcome, Sarah.
Hi, thank you for having me.
It's wonderful to have you here. You are one of our speakers of the Gold Tongue Tie Online Symposium 2022, a big event we put on every year, 2 full days of presentations, and you will be live with us on September 13th, I believe, right, Sarah?
Yes, I believe I should check my calendar before I say yes for sure, but I'm pretty sure
Yes.
that's it.
So Sarah, it's first of all, it's lovely to have you here. Your presentation is titled Beyond Breastfeeding, the Long-Term Implications of Tongue Tie in Our Adult Patients. And I want to talk about that in just a moment. But first of all, I want you to talk a little bit about yourself and your background. I know you started out as you have a degree as a dental hygienist.
Yes.
And then you got into the world of tongue tie. So tell us how all this happened.
Yeah, it's a long story, but back in probably 2010, I was interested in getting additional training. I was a dental hygienist, and I was interested in other options for my career. I took a class on myofunctional therapy. And back then, it was such a different world. No one was talking about tongue ties. No one was really interested in the myofunctional therapy stuff that I was learning about. And I was sitting there in the class, and a lot of the things that I was learning were related to me. And I recognize these symptoms in myself. And so I really think if it wasn't for that self recognition I had at the time, I probably wouldn't have pursued the field. But I just thought, if I have this and I'm a dental hygienist and I've never heard of it before, then maybe there are other people who need help, and I want to learn more. So uh, the myofunctional therapy is really significantly intertwined and connected to tongue tie, and I'll talk much more about that in my presentation. But there's a big overlap in the field and the therapy exercises, especially for like pre and post-op treatment.
Wonderful. So yeah, tell me, what does an orofacial myofunctional therapist do exactly? You mentioned you are doing exercises with your clients. Yep. You're doing assessments. So
Yep.
walk me a little through about how this works, because I'm fascinated. I looked at your website. I know you're offering trainings as well, but I want to learn a little more first. What is it that you do exactly?
Yeah, so picture physical therapy, or maybe if you live in Canada or Australia, you call it physiotherapy. So it's just exercises for the muscles of your face, and specifically your mouth, and especially the tongue. So we work on tongue posture, nasal breathing, lip and facial muscle exercises. And it sounds kind of weird, but it's actually, and I will get more into this, but we're just talking to our patients as a therapist on how do we restore your normal function, your normal breathing, tongue, and muscle function for your oral facial complex. So it's not about doing like exercise to get strong or to, become an athlete for your face. It's more like, how do we just get you to be healthy and functioning as you should?
So when clients come to you, obviously they come to you because they have certain things that they want to improve on, or have breathing difficulties, as you mentioned. So you're working with adults. You're also working with children. Is that correct?
I mostly see adults. So in the early days of my career, I saw a lot of kids, and as things evolved, I ended up kind of with a very adult focused, specialized practice. And now I have 4 therapists who also do therapy, and 90% of our patients are adults. And they don't usually come to us thinking they're tongue-tied. Some do, but a lot of times they come to us with these other conditions, and we kind of trace these conditions and symptoms back to the fact that they're tongue-tied. So the main things that my patients have are sleep apnea or some form of sleep disordered breathing, snoring, or TMJ issues. So jaw pain, headaches, facial pain, clenching, grinding, things like that. And then we start to help them by kind of unraveling their health history and understanding maybe these big problems or symptoms you're having can be explained by some of these root causes like tongue posture, mouth breathing, and tongue tie. So it's very interesting.
Absolutely fascinating. I can't wait to learn more. Now you really got me interested and excited to
Good.
to listen and watch your presentation here as well. And so you have therapists working for you. You also offer training for professionals, right? So talk about that
Yes.
a little bit.
Yeah, so my practice is called Faceology. It's an exclusively online practice. I've partnered with another hygienist, myofunctional therapist in the field. Her name's Melissa Mugno. And so we've really merged our two practices to create something that we really hope is just kind of taking therapy to the next level. So I do have my practice and I run that. I still take on a couple of patients here and there, but most of what I do is in the educational and lecturing space, things like this. So I do teach a course. It's 12 weeks. It's for dentists, dental hygienists, speech pathologists, and really anyone who's interested in the oral facial breathing space who has a license and in their scope to learn these things. So the course is all online. I've been teaching it all online since 2000, really 2000, probably 15 or 16. And, so much has evolved and changed. It's really amazing how not just my class and my practice, but the field that I'm in, it's grown so much. And, it's amazing to see where we started in 2010 and where we are
And
now in 2022.
it's fascinating, absolutely fascinating. Such a growing field.
It is.
And it's evolving, and we get to learn more. There's constant new research coming out, new developments, and also interesting. Not always everybody agrees. Some you have heard this. Some say like we need to relieve the tongue tie, we need to do the frenectomy. Other people say no, we don't. And it's interesting because that's how a field develops and evolves as well. Because we can learn so much from other experts there as well.
Yeah, and our lens of what we look at, and I'll talk more about this in my lecture, but we've had new grading scales and grading systems evolve really since probably 2017 until today. So even the lens that I was looking at my tongue-tied patients through in 2010 or 2015, I look at them through a different lens now. And so that explains where some of the arguments or disagreements can come from, is we're looking at it through different sets of grading scales and research, or even the difference between looking at a tongue tie in an infant versus an adult. So it's very interesting, and it is evolving every day. So
that's fascinating. So let's talk briefly about your presentation. And you mentioned a few things that you will talk about. So the title is Beyond Breastfeeding: The Long-Term Implications of Tongue Tie in Our Adult Patients. So tell us briefly, what can we look forward to learning from you?
Yeah, I'll be talking about what does a myofunctional symptom look like in an adult. So all of us listening, I'm sure attending, are adults. And so I really recommend when I talk about these things for everyone to kind of reflect and be introspective of their own symptoms, because that's really the best way to learn. So I'm hoping that everyone can take away a better understanding of their own function and their own, tongue tie if they have one. And I'm really hoping that by the end of my presentation, people will understand how tongue tie specifically is related and can contribute to bigger issues in adults, like sleep disorder breathing and pain, TMJ and all those issues. So I'll be talking about the why behind that. And I have a ton of research that I'm referencing to back that up. It's always something that I think people say, oh, that sounds great, but where's the literature? Where's the research? So my goal is to provide that for everyone. So I've got a lot of resources to talk about.
Wonderful. Sounds exciting. I can't wait for the presentation. And it's just around the corner, September. It's not that far from now. So for our viewers now, if you are interested in learning more, learn maybe more about your own, facial muscles and tongue tie that you possibly have, and also how that knowledge helps you in your lactation practice. And if you're interested in all the other presentations in that tongue tie symposium, you can find more information at goldlearning.com. Thank you again. It was lovely speaking to you, Sarah, and I'll see you in September.
Thank you so much. I can't wait. And I'm looking forward to meeting everyone and to talking about these really important topics.
Thank you so much. Bye-bye, everyone.